Hi, my name is Natalia Cantos and I will talk about the role and impact of cooperative extension in diabetes education in self-care. Definition: diabetes self-management education is recognized as a key component of effective diabetes care. DSME is a collaborative process through which people with risks for diabetes gain the knowledge and skill needed to modify behavior and successfully self-manage the disease and its related conditions. This process incorporates the needs, goals, and life experience of the person with diabetes.
Have you or a family member been diagnosed with diabetes? Do you feel overwhelmed by the information you've received about how to manage your diabetes? Good news! There is a valuable resource available to help you take care of your diabetes. Diabetes Self-Management Education is a program where you will get customized one-on-one training from a diabetes educator. A diabetes educator is a specially trained individual who understands what you are going through and can help you make a plan and put the skills you learn into practice. You also get group support from others who have diabetes. This program will help you learn the skills needed to manage your diabetes and thrive in your life. And as an added bonus, diabetes self-management education is covered by most insurances. Ask your doctor for a referral to Diabetes Self-Management Education today, or visit livingwell.utah.gov to find a diabetes self-management education program near you.
Application in nutrition: daily care is managed by you. The planning class: choosing what, how much, and when to eat. Keeping a healthy weight: making sure you include physical activity in your day. Taking medication to help achieve your goals for blood glucose, blood pressure, and cholesterol.
Dr. Pham, we hear a lot about lifestyle changes in diabetics. Diet, lifestyle, exercise is mentioned all the time. Do you think diet and exercise alone is sufficient to take care of type 2 diabetes?
Oh, absolutely. Diet and exercise is the most important intervention for diabetes. Now, all other things we do, such as pills and insulin, they really play a supporting role, and they should be used in conjunction with diet and exercise. Now, the medicines we use definitely will have less success and durability without a good dietary plan. Some patients early in the diagnosis of diabetes may be controlled with diet and exercise alone, but if you think of the progressive nature of diabetes, it's typical to require additional medications eventually. And as it's important to be aggressive early on, it's always a good idea to consider that, even if you have good or normal control, so that it decreases the workload that your pancreas has to do and improve the longevity of the pancreatic function over time. So even though you can control diabetes with diet and exercise, using medicines as an aid is always a good idea, even when you have good control.
Pros: individuals with developing diabetes can have an impact on the progression and development of their disease through intensive self-management activities. The International Diabetes Federation (IDF) recognized DSME as a critically important, fundamental, and integral component of diabetes prevention and care and should be available and accessible to everyone. Cons: one of the main patient barriers was not being aware of its needs. Another common barrier is the cost or lack of insurance coverage, which makes it difficult to diagnosticate the disease on time. Apply in Ecuador. According to the National Institute of Statistics and Census (INEC) in 2018, diabetes mellitus was the second cause of death in the country. For that reason, the MSP made a practical guide called Diabetes Mellitus, in which they teach you carbohydrates. Carbs include bread, rice, cereal, and fruits. This can all raise your blood glucose levels, but keeping the amount of carbs in your meal consist daily will help reach target glucose levels. The guide also recommends you can still enjoy the food you like, but in moderation. It is important to include more high-fiber foods such as fruit, vegetables, dried beans, oatmeal, and whole grain breads and cereals. Conclusion: Diabetes education programs collaborate with dietitian educators to develop a 4-lesson using the play format to teach individuals about the type and amount of foods they should consume at each meal. The management of diabetes self-care is largely the responsibility of the patient and their interest in making dietary and lifestyle changes. Several factors have been associated with an increasing risk of developing type 2 diabetes, such as a family history of diabetes, being overweight, having an unhealthy diet, physical inactivity, increasing age, high blood pressure, impaired glucose tolerance, history of gestational diabetes, and poor nutrition during the pregnancy. Thank you.